Today, we're exploring a cutting-edge approach to dentistry where beauty meets bite. You might know about Botox for smoothing wrinkles, but did you know dentists are now using it with their expert knowledge of facial muscles for real relief? To explain this savvy fusion of cosmetics and care, we're joined by Dr. Andrea Smith and Dr. Melanie Marshall.
Thank you for having us.
Of course. Okay, Dr. Smith, most people think of Botox as a cosmetic treatment. How are you using it in your dental practice to help patients with jaw pain or TMJ issues?
Yes, in my office, I'm using it for a therapeutic application. The muscles that we eat and chew with, smile with every day, sometimes those muscles can become very, very tense, and that can put pressure on the TMJ or the temporomandibular joint. And so as these muscles are being contracted, it is causing the muscles to become sore, it is wearing away the teeth, and it's causing all sorts of problems for their bite.
Okay, and we want to obviously help them relieve those issues. So for viewers who may not know, can you explain what TMJ is in simple terms and what kinds of symptoms someone with TMJ or jaw tension might experience?
Yeah, so TMJ stands for the temporomandibular joint, and that is the joint that opens our mouth and closes our mouth. And it's like a hinge. Sometimes you can think of it as a door, like a door hinge works. And if you can imagine a door hinge being off track, that can cause some problems with the way that the door closes. As a result, all of the musculature that surrounds that door hinge can become very tight, tense, and sore, causing undue pressure on the teeth and other problems. And so Botox is a neurotoxin, and it actually relaxes the muscles and it controls that tension that occurs in the jaw when you're overusing the jaw.
Okay, and you talked about pressure on the teeth. Dr. Marshall, a lot of people, they grind their teeth. Most of the time they don't know it, especially if they're doing it at night when they're asleep. So what's the medical term for that, and how is it traditionally treated?
So the medical term is bruxism, and that describes clenching or grinding. And usually what will happen is their jaw will be tight. Sometimes even their muscles down their neck and up their temple can be tight as well.
Yeah, I can imagine that's a lot of pain that they're dealing with. So compared to those traditional treatments, how can Botox help someone who grinds their teeth or has constant jaw tightness? What kind of relief can it provide?
So the traditional treatment would be a night guard, but a night guard doesn't solve the full problem. So that's where Botox comes in, because we can help to relax those muscles that go up the side of the head and down the neck, but also it can help to reduce the headaches that are associated oftentimes with bruxism.
Okay, and then some still might think Botox is cosmetic. Dr. Smith, so why is a dentist, especially one trained in facial and jaw anatomy, the right professional to perform this treatment?
Well, first of all, the teeth are a very cosmetic part of, of our body.
Yeah.
But more than that, on some of the before and afters that you've shown, the muscles can become more relaxed, and as they become more relaxed, they become more slenderized. And so when they're slenderized, they're weaker, they're not able to grind as much, and you're able to protect your teeth, and the muscle pain goes away also with the Botox injection.
Okay, and then you brought along a patient testimonial, but before we share that, what can someone expect during a consultation with you if they're curious about whether Botox for jaw pain might really help them?
Well, the first thing we do is, well, of course, talk to them. And we perform a complete muscle examination. We are examining all of the head and neck muscles. And from there, I do it's called a visual analog scale test, where I do a series of anesthetic tests to see if their muscles actually respond. So long before I reach for the Botox, I'm using things like ethyl chloride or my laser, something to see if those muscles are going to actually react. And if those treatments help, then I know that Botox is going to give them a 3-month duration of relief.
Wow. Okay, well, let's hear from one of your patients.
Okay.
All right.
After the first treatment you did, the tension in my jaws, in between my eyes, my headaches, all the way around to the back, even with the shoulders, it just, everything just started to feel better. And I am a big believer in it. I would recommend it to anyone. There's something that helped that jaw. It just, whether you want to call it loosened it up or softened, I sleep better. So it was a great transformation, and I learned a lot from it.
Very good. Thank you.
You hear the relief that she has, not having that tension anymore. So it's bringing a lot of resolution to your patients.
It actually does. Often these patients don't even realize what pain they're in until that pain disappears with that Botox injection.
Yes.
So it's very, very life-changing for them as well.
Yeah, well, we want to make sure our viewers know how to get more information. Thank you again for joining us. And to our viewers, you can learn more by heading to smileagainnow.com or call 916-482-8300.